Hi, this is Dr. Dari Hamra, facial cosmetic surgeon, Washington, D.C. Today I'm going to answer one of the biggest questions I get about rhinoplasty. Doc, do you perform open or closed rhinoplasty? So I want to just be clear that the difference between open and closed rhinoplasty is one thing, and only one thing. It's a little incision in the bridge of the skin between your nostril called the columella. That's it, guys. If that incision done properly, you cannot see it. You can see plenty of my before and afters on my website or on my Instagram at Dr. Hamra. You cannot see the incision, okay? And here's why. The design of the incision is key to whether or not you can see it at the end. So if you've seen someone that had a rhinoplasty and you saw clearly that there's an incision, that was just done not performed properly. That doesn't mean that every open rhinoplasty is going to look like that. Just like a car that has a dent, okay? Not every car has a dent. The reason why that car has a dent because it hit something, okay? It was an accident, or the driver wasn't that good or experienced, or the driver was distracted, okay? So it's very important that you choose a doctor that is proficient in what he or she does, okay? Then you don't have to worry about open versus closed. The reason why there is so much question and confusion about open versus closed because the terms are frequently used as a marketing pitch to attract patients. Of course, closed rhinoplasty sounds really good, or scarless rhinoplasty, okay? Again, if you do incisions properly, you can't see a scar. A scar means wound edges that were not sewn together properly or didn't heal properly, okay? It's that simple. So I could do an open rhinoplasty and have 10 people look at the nose, or 10 surgeons look at the nose, surgeons that perform rhinoplasty, and they wouldn't know whether it was done open or closed, period. It's because of that little incision. Because everything else in both instances is exactly the same. Even a closed rhinoplasty has incisions along the inside of the nostril. So that really doesn't make it closed, does it? Because you actually open the nose, you just don't have the bridge here, okay? Because all the other structures are going to be separated the same way. The skin is going to be separated from the cartilages and the bone underneath in both instances. So as to the recovery, it really doesn't make that big of a difference, if any at all. Recovery actually has to do with how well versed your surgeon is with the techniques. So you could have someone that is not that experienced and does a closed rhinoplasty, and the patient gets swollen and bruised way more than someone had an open rhinoplasty with a very experienced surgeon. It's that simple. So I don't want you to get too caught up into this terminology and understand what they actually mean, so that you're not shopping around for a technique, but rather than look for the best surgeon, okay? If your surgeon is experienced in rhinoplasty, he knows all the techniques, and he will apply the technique that yields the best result. And ultimately, that's what you should care about. You should care about your results, okay? Not what technique is used. These are nuances we get caught up with just because we're getting all this marketing information from online, and marketing is really, it's kind of like being tricked a little bit. So I found it, to be honest, a little unethical of some people advertising, attracting patients, and rather than talking about their experience and the results. So as a patient, what should you do? You should do your research, make sure your surgeon does a lot of it, make sure your surgeon is familiar with all the techniques, and ask them why they will choose a technique versus another one on your particular nose. And if it makes sense, and if your doctor can explain it well, they probably know what they're talking about. They probably have done this before, if not plenty, and that's what you want to look for. Hope this video helped to clear up some confusion that's out there, because I get that question a lot, and I always have to redirect my patients in thinking the right way. Thank you very much. This is Dr. Dari Hamra, facial cosmetic surgeon. Have a nice day.